There's a significant number of women who are in the SEER Medicare database. So the first thing is that we took the SEER Medicare database, which looks at women who are over 65, and it links them to the SEER database. And this is a very powerful database because in addition to identifying women with ovarian cancer, we then get to see all of the claims that were made to Medicare for everything that the patient had during that period of time. And so what we found initially, or what we found in this study, is that a substantial number of patients, approximately 20% of patients, are not receiving any cancer-directed therapy towards their ovarian cancer. We found that only 39% of women actually get treated with the NCCN guideline therapy. And I think what was, very encouraging to us was that women who received NCCN guideline therapy, which has been associated with improved outcomes, better survival, that the cost of NCCN guideline therapy was actually less than when people were not treated with NCCN guideline therapy. So, you know, the overall median cost was about $80,000 for that entire initial episode of care. But we found that with NCCN guideline therapy that we were looking at probably about $8,000 less in terms of overall expenses when patients were being treated with, you know, what's likely to give them the best chance of cure.